So one of the biggest questions that we get then is, how do I treat obesity? What do I need to do to lose weight and keep it off? And so our program is addressing each stage of weight loss. Prevention obviously is going to be best, but then if a person is already overweight or obese, then we need to know what we need to do to treat it. So of course, prevention is the best medicine. We do need to recognize the people who are at risk for overweight or obesity, and then that way we can implement certain lifestyle changes and ways to help keep them from developing overweight or obesity. But once a person is already overweight or obese, then we need to discuss how to lose that weight and how to maintain that weight loss. There are different phases of weight loss, and the first is called active weight loss. This is when a person is actively losing the weight, the pounds are coming down. All of these factors that are causing obesity need to be addressed. We would go through a list of the person's medications that they're currently taking. They can discuss with their doctors, their other specialists, what are these medications that are causing weight gain? Can we change these to medicines that can either cause weight loss or at least not cause that weight gain? We also need to address any other medical conditions. If the person has sleep apnea, this definitely needs to be addressed. It's not only a cause of obesity, but it itself can cause obesity. So it's kind of a vicious cycle on that one. We need to get that sleep apnea treated so that you can successfully lose that weight. We need to make sure that there's nothing else going on with the thyroid or any other kind of endocrine disorders that can cause weight gain. Dietary changes are obviously going to be a very crucial role in the active weight loss phase. We need to develop what we call a negative energy balance. This is where you have more calories burned than you have going in. This is not the only way to lose weight, and it's certainly much more complicated than that, but we definitely need to address it as part of our program. There's several different diet plans and fad diets out there. Really, the best predictor of weight loss is adherence. So the diet that works is the one that you can do. We want to maintain a healthy diet and not do something that you can't continue on for your life, because then that would just kind of set you up for a failure. Weight loss medications are definitely a big part of the way to lose weight and to keep it off. This should definitely be something that's prescribed by a physician. We want you to avoid using any kind of herbs or supplements, any kind of over-the-counter diet pills. A lot of these are seen on the market. They can say that they'll make you lose a lot of weight, but they're not studied well, or they have actually shown that there are dangerous side effects from these. So it's definitely important to talk to your doctor about any kind of supplements that you're taking if you're trying to lose some weight. The medications definitely need to be a part of a comprehensive lifestyle change. Medications on their own can help you lose a little bit of weight, but as soon as you stop that medicine, then that weight may come back. So you want it to be a part of a healthy diet and exercise program as well. After the active phase of weight loss, a lot of times there are complaints about people hitting what we call a plateau, and that's where that weight loss kind of levels out. This is in the transition phase. A lot of times we will retest the metabolic rate. We'll see if we need to adjust the diet plan at all. Medications can be adjusted. If you've hit that goal weight, then that's another reason why you would be in the transition phase. And so it may not be that you're plateauing, it may be that you've lost the amount of weight that we're aiming for. In that case, a lot of times the medications may be tapered down. You can take them less frequently, or maybe we'll stop them altogether. At this point, we would create what we call an action plan. If you have asthma or know someone with asthma, then you may have heard of the asthma action plans. Kind of a similar concept. What we would do is we would give you some certain weight targets, and if you start to regain a certain amount of weight, then we'll let you know what you need to do. Do you need to call us and come back for an appointment, or do you need to just make certain changes that you can do at home? So we'll come up with that during that transition phase. So then we get into the weight loss maintenance phase. So if a person has already lost down to their goal weight, they've achieved that, that's an excellent goal. Maintaining, though, is the hard part. There's less social reward that comes along with this. A lot of times, as you're losing weight, people tell you you look great, you're doing so well, you're losing all this weight. But then after you've lost it and you're maintaining it for 6 months or a year, you don't get as much of that feedback from people. So it can be a little more difficult to continue on with your program. This is where exercise becomes very important. Once you lose weight, your metabolism is actually slowing. And so exercise is a way to maintain that metabolism. The National Weight Control Registry is a database of people who have successfully lost at least 30 pounds or more and maintained that weight loss for over a year. We have some successful strategies from members of this registry. There's different diets that they've been on. Some have seen success with the low-carb diet, the low-calorie diet, obviously. These people do have a much higher physical activity level than others. They limit their TV time to less than 10 hours per week, and this has to do with a lot of their activity level. So if they're not watching as much TV, then they're out walking and they're doing things more physically active. Regularly eating breakfast is one thing that they do, and this is very important. The more calories that you get at a certain meal, that meal needs to be earlier in the day. Earlier in the day, those calories are used they're being burned off for energy. Later in the day, those calories are being stored away as fat. So a bigger breakfast, high protein, low fat, and then having a high protein breakfast also helps to keep you full through the day, and you're not going to be starving when lunchtime rolls around. Several of these people will eat several times daily. This also helps to keep you from getting too hungry at a mealtime, and they avoid eating out. You have much more control over what calories and what ingredients that you're getting if you eat at home and make your meals yourself. Frequent self-monitoring is definitely something that has been studied a lot, and they have shown that people are more successful in losing and maintaining their weight loss if they are monitoring their calories, they're weighing themselves regularly, and they're keeping tabs on their progress. If you're a diabetic, then you're going to check your blood sugar, and that is how you would know how well controlled your disease is. And the same concept applies with obesity. So you want to maintain that regularity of checking your weight, making sure that you're not getting off track with your diet or your exercise plan. So weight regain is definitely a reality. It does happen, and it doesn't mean that you're a failure at your program. This is something that your body is kind of battling against you for. There are these hormones in the body that make you want to regain the weight. They're trying to push you back up to this set point, if you will, of your weight. They cause you to have increased hunger and decreased feelings of fullness, or what we call satiety. As I said earlier, metabolism also slows down as you are losing weight, so it's very important to maintain muscle mass. As you're losing weight, you want to do some weight training in addition to cardiovascular exercise in order to maintain that muscle mass and maintain your metabolism. Exercise and diet plans are difficult to maintain if they're not part of an overall lifestyle change. So that kind of comes into the fad diets and the exercise programs that are a little too extreme for people. If you can't carry it on for the next several years, then it's not going to be a successful plan for you. If you do start to regain some weight, then we need to address that. Sometimes it may mean that you may need to exercise a little bit more. Sometimes it may mean that we need to decrease the calorie intake a little bit. And sometimes a weight loss medication may need to come into play. If we've tapered you off of your weight loss medication, then this may be a time to restart it for a little while. So it's definitely something to discuss. So as you can see, weight loss is very complicated, but it's doable. So there are factors in the body that are working against you, but we can work against those as well. We can work with diet, we can work with exercise, medications. All of these things come into play when treating somebody for obesity, and it's good to have somebody who knows how to address each of these issues to help you successfully lose weight.